Hello and welcome to today's webinar, which will explore cognitive behavioural therapy and also mindfulness-based approaches to support you in your role as nurses and midwives in order to be able to tap into your own resources in a very busy environment, sometimes very challenging environment, and to best support yourself, and in doing so also connecting in the best way possible to the role that you have, but also the patients that you're working with. So how can cognitive behavioural therapy help and support? Well, we're going to first of all explore an understanding of cognitive behavioural therapy and how it can support us to maybe step back and understand when we get triggered, what kind of thoughts get triggered, what kind of, what do we do or not do because of that, and also how our feelings influence what we do or don't do. We'll look at helpful versus unhelpful thinking styles and how to be able to catch ourselves so that we don't get hooked into those habitual ways of thinking or maybe doing things that don't exactly serve us. We'll look at emotional triggers because, of course, when we feel in balance, when we feel supported, then obviously that helps us in terms of our own needs to feel fulfilled and those positive feelings. But equally, when we're under stress and when we're feeling under pressure, it can trigger those emotional triggers. Or if we have a difficult situation in terms of a patient or a colleague, it can trigger those feelings that are more challenging to deal with. So how do we manage those emotional responses? We'll look at also our nervous system and an understanding of our nervous system when it gets triggered, less from physiological aspect, but more to understand what happens psychologically when we get triggered and what happens to our nervous system when we're very much aroused, and what are we likely to do because of that. We look at some really helpful journaling approaches, and journaling is very helpful in terms of helping us to both process what we're going through emotionally, but also to maybe identify the deeper, more subconscious ways that we are engaged with people or situations that may be informed from previous learned experiences, for example. And we'll look at active listening skills and how they can support you both in your relationship with your colleagues, also even actively listening to yourself, and also how you support patients and how active listening can really help there. And finally, we'll look at mindfulness-based approaches for stress reduction. We hear a lot about mindfulness these days, but how can you tap into mindfulness in the here and now, in the, maybe you've got just 2 or 3 minutes. Even in that time, you can create that pause in order to be able to reflect and just gather yourself before you make the next decision or take on the next task. So when we look at cognitive behavioral therapy and really what does that mean, and therefore how can it support us, it's really an understanding of how we engage with the day-to-day in terms of our internal dialogue. Very often we're on automatic pilot, so we're not necessarily aware of our thoughts and how they are influencing what we do and what we don't do as a result of our thinking. So we can make lots of assumptions about other people. We can make lots of assumptions about ourselves. We can have maybe a very active internal critic, and that can be very undermining in engaging with the tasks that you're doing. Or we can make assumptions even about the patients and their intentions. So when we're aware of our thinking, we can adapt really to having a more of a witnessing aspect to it. So we can observe our own thinking and therefore pause and make choices around what we'll do or don't do as a result. And naturally, that also influences how we feel. Very often in situations that are difficult, it's our feelings that we tune into first, and therefore we begin to emotionally react rather than emotionally respond. And when we become aware of this process and our own process in that regard, it gives us more choice. So by making a link between what we do and what we feel, CBT can make us change. In other words, we can change. We can actively be participants in that process, as opposed to very often we don't have that emotional awareness and we literally react from our internal dialogue. So assumptions that we make, opinions that we hold, or even conditioning that we have in terms of our belief systems informs our thinking and then what we'll do or won't do. When we make positive changes and press that pause button and just reflect and maybe find a more supportive self-dialogue in times of challenge, then that's also going to influence more positive change in terms of how we feel. So it will also help us to achieve what we want to achieve in the longer term. So there's that emotional shift. CBT mostly focuses on our belief systems and our thoughts, and perhaps also how they've been informed by previous relationships or past events, or, you know, the context within which our thinking arises. CBT basically says it's not the triggering event that causes a problem, but it's actually our interpretation. So it's important that we're aware of our interpretation of relationships, of our interpretation of habitual ways that we relate, or habitual ways that we respond to challenging or stressful situations. So we might get triggered by interactions with our colleagues or patients or with personal relationships, but equally our reaction will differ to the person, another colleague, for example, and that's based on how we interpret it. So it's important that we are able to pause and reflect on, how am I interpreting this, or what am I noticing in my body here? How am I carrying this stress? Am I feeling a bit anxious, a bit stressed, a bit irritated? And because of that, what am I likely to say or do that maybe isn't very helpful in this situation? Can I just pause, notice that, and then make a choice? And that makes all the difference to our longer term experiences. And you can accompany this webinar with just, you know, taking pen and paper, or even better still, having a journal and exploring how you approach difficult situations, maybe by even noting, for example, in the last week or so, what have been your most common stressful triggering situations? And why is that helpful? Because very often those can be repeated. They can be, we can react or think or behave in similar ways by similar triggers. If you know, so if something happens, it reminds us of a previous situation when the same thing happened, and that means we might get our defenses up, or we might shut down or feel distressed. So when we can actually unpack that a little bit and dig down a little bit deeper, then the next time something comes up that's similar, basically we can apply that learning to that situation. So for example, looking at the diagram there, we can have lots of feelings. We might have, something might happen in a workplace, and you might have acceptance that, well, you know what, this is a bit challenging, or I'm finding this difficult, but it's okay, I can manage it. I've managed similar situations before. Or indeed, it might create a sadness. You might be supporting some patients through very difficult times, and you might feel quite sad about the outcome, and left, you know, unsupported. That sadness, if you have found yourself in those situations over and over and over, you might find actually sadness becomes depression. So if we're very isolated, if we feel unsupported, if we're overwhelmed on an ongoing basis, that, you know, low mood can escalate into depression, or concern and fear, you know, can escalate into anxiety. So how do we notice that? Well, that's, you know, by not experiencing, for example, burnout, being able to self-care, being able to identify our feelings and our needs in those situations. Equally, in terms of relationships, we can work, maybe we can have a sense of teamwork. If there is a difficult situation, we can support a colleague, or we can ask for help, we can delegate. So we have that formal and informal support. We can support ourselves internally, or perhaps we might get, you know, become quite infantile. So we might react to a situation from a learning that, oh, this is the way I should react in this, because otherwise, you know, it'll be overwhelming, or somebody else will take advantage, or basically we can react from conditioning from earlier life relationships. We might even have a sense of how we're feeling, if you've had enough rest, if you feel you've had enough sleep, if you're eating well, if you're getting your exercise, all those things that support us on a physical and psychological, emotional resilience level. Then, you know, in terms of relationship, you might feel that you can be patient with people, even though it might be at times challenging. You feel that you've got that well of resources, as opposed to, you know, overwhelm, and then we might feel emotionally numbed out, so disengaged. We can feel that we have control of situations, or we can feel that we want to control situations. And that's important, that we're aware of what's in our control and what's outside of our control. What actions do we need to take? But equally, when do we need to step back and accept that certain aspects are outside of our control, maybe not our responsibility? And then that coping, we can cope in an adaptive, functional way or a non-adaptive way, and perhaps don't even have the awareness that, you know, we when we're in relationship, if there's conflict, we might get frustrated, which is fine, or we might step into anger. And very often those are learned behaviors. So it's important that we can occasionally step back in our trigger situations and identify what's happening for us. And a great way to do that is actually to journal. So for each triggering situation, just take your common 3, you know, relationship issues or issues in relation to work-related issues. What are the top 3 things that tend to trigger you? And then just basically get a pen and paper. And by the way, it's much better than typing, because you tend to access the prefrontal cortex part of your brain, which explores a little bit deeper the emotional reasoning behind why we're doing things. So when you write down the triggering situation, be very specific. What specific triggering situations are your top 3, say, for example, and take each one and then write down, you know, when that happens, what are the common kind of thoughts that arise for you? Now, they might be helpful, unhelpful, neutral thoughts, critical thoughts, assumption thoughts, but just notice, okay, what kind of thinking comes up for me? What do I believe in that situation about myself? Or what do I believe about the situation itself? What do I believe about the other person involved? Just write down the common thoughts that come up for you. Don't judge them, just note them. And then very often within our thoughts, naturally, we have beliefs that are triggering thoughts. So what assumptions do I usually make about myself in that triggering situation? Or indeed, what assumptions might I make about colleagues? Or if it's in relation to a patient, what assumptions about the patient? And then write them out fully, as much as you can, write them out. And then imagine that that somebody was playing back a film. So a little bit like this webinar. But imagine this is when you're feeling really triggered. What would you see in that film? What would be happening? What would it look like? How would you look? How might you be physically holding yourself in that situation? Would you stand away from people? Would you hold your head down? Would you punch yourself in? Or would you be standing, you know, would your arms be folded? How would you know that you were in this triggering situation? What would it look like? And it's helpful to know that. So when you find yourself physically doing this, you go, okay, what's going on for me right now? What are you likely to be feeling internally? What kind of feelings are going on? List all the feelings that you might have. And where would you carry those feelings? So if you're feeling stressed, where do you carry that in your body? So, and also now that you have identified all of this, also note, what might you do in that situation because you're feeling like that, because you're thinking that way? How might you react? What might you do? Or indeed, what might you avoid doing? So what are your defense behaviors? In that way, you know, what might you move away from? What might you avoid? Sometimes that's very healthy, sometimes not so healthy. So it might be that you avoid being assertive, identifying your needs, expressing your needs. You might say yes to everything. Or it might be that you become very defensive and you react and move away from it very quickly and shut down and ignore that person from here on. So just notice, what are the kind of behaviors that when you feel that way, what are you likely to do or not do? And when you identify these ways of thinking, feeling, behaving, you can also find the alternatives. So if you're kind of being a friend to yourself, if you're being more self-supportive, we'll come on to that. So what's the alternative? First, identify the whole process and then begin to look at the thinking styles that are common in your thinking. Circle them and look, is there any of this going on? So is there any selective abstraction? These are common unhelpful thinking styles. In other words, it's been identified that when people feel quite anxious or low or unhealthy anger, by the way, there's such thing as healthy anger too. So in these ways, there is common ways of thinking that have been identified. So just note if any of this is happening for you. Selective abstraction, so drawing conclusions on the basis of one or some of the elements of the situation. So a certain things happen and then you draw a conclusion. This means that because of this, this is going, if then, this is going to happen. So are you taking, you know, some aspects of how somebody's behaving and then making huge assumptions based on that? Or you might be over personalizing. So this is all my fault. So something happens and then you over personalize the level of responsibility for events which aren't under your control, or so something may happen that doesn't work out with a patient and you might over personalize, you know, this is my fault, I should have done this, I should have done that. It doesn't mean that we don't take responsibility. Of course, we take responsibility and we say, okay, what is my responsibility? What was not my responsibility? What are the variables here? But if something doesn't work out to the best in terms of maybe a conflict with a colleague, or somebody is, you know, impatient with us, and I think, oh, I'm useless, this is my fault. So we over personalize our level of responsibility. Or we might magnify it, so we might blow things out of proportion. So there might be, you know, somebody's under pressure, they're less than you know, friendly with us or something, and then we catastrophize. So we say, oh my God, you know, they didn't make eye contact with me on the corridor, they don't like me, therefore I won't get promotion. You know, we can really catastrophize and magnify things out of proportion. And when that happens, quite often, as well as dealing with kind of hypothetical worries where we go into this narrative, it can actually lead to anxiety. Or we might minimize it, you know, we might minimize, downplay the importance of a positive thought or emotion or event. So for example, somebody says, well done, you know, that was really well done in relation to how you managed that situation. And you go, oh no, actually, you know, anybody would have done the same thing. That, you know, that's not very, you know, it's not very good at all, really. So we might minimize our achievements, and that can, again, all of these things are often informed by earlier life experiences as well. Or arbitrary inference. So we might draw conclusions when there's little or no evidence. So we might say that's absolutely going to happen, or that's absolutely not going to happen, or this person is absolutely this way, or they're absolutely that way, based on one thing rather than an overall experience of how the person is. So we can overgeneralize, we can make sweeping conclusions about events. So lots of different unhelpful thinking styles that we need to be aware of. We can also get into all or nothing thinking. So it's absolutely this way or it's absolutely that way, and ignoring the you know, the gray areas in between. So if you make a mistake, you can think, I am a mistake, or I'm always making mistakes, rather than this is a mistake, but overall I do really well. So it's about looking at the overall. So then coming back to your triggering situation, and how do you challenge any unhelpful thinking styles that you've identified, where you circle those unhelpful thinking, those thoughts, and think, oh yeah, they kind of fit that description. Well, in response to common thoughts or any unhelpful thinking styles, you can begin to develop that muscle of an alternative way of thinking. Very often we're, you know, trained to kind of look for risk, and trained to basically sometimes have a negative bias. So it's important that we balance that. So you might take your most unhelpful thinking approaches in triggering situations, circle them, and then ask yourself these questions about that. Is there another way of looking at this situation? Or how would I prefer to think about this situation? If I was being a little bit more compassionate towards myself, how would I think about this situation? Or how might somebody else look at this situation? And that can give you a different perspective. What unhelpful thinking styles might I be using here? When I look at the way I'm thinking about myself or the situation or other people, is there any unhelpful thinking styles that it seems to fit into? And then what you can do is actually divide your page into two, and evidence that supports that way of thinking and evidence that doesn't support that way of thinking. So what evidence says that that thinking style about myself or others is true? And then is there any situation when it's not true, or is it not true all of the time? Because very often we can overgeneralize. Maybe ask yourself, are you judging yourself harshly or somebody else based on this one experience? Are you making lots of assumptions that this person is all this way all of the time? Or is it possible they're having a bad day, for example? What are some other things that could be happening here? What is more probable? So, for example, with a difficult patient, are they just very difficult? Or is there something else going on for this person? That maybe if I can be, empathic of, it's not that you have to deal with really challenging behavior and say, oh, that's okay to be mistreated. Absolutely not. But when we broaden the picture and we think within which context is this happening, then actually we can see maybe the wider perspective, helicopter view. So what are the other things that could happen? Equally, if we're looking to the future and we're looking at hypothetical problems or hypothetical worries, then what else could happen here? What is equally likely to happen or even more probable? And can you really predict the future? And is it actually helpful to move in our time machine into the future? Is it more beneficial to think, okay, what do I need to do now? What do I need to do this week? Am I exaggerating how bad the result might be? And what is more realistic? You can look at it from the perspective of a friend or a loved one. So if a friend or a loved one was looking at this situation or had this thought, how would I encourage them? And does this thinking approach help me, or does this thinking approach hinder me? So instead of making assumptions, could there be an alternative viewpoint? And just expand a little bit more on that. When you list your common triggering situations and your ways of thinking, when you begin to write this out and explore alternative, more self-supportive ways of thinking, very often then, when you do this often enough, maybe for 3 or 4 triggering situations, when the similar situation comes up, you very often can apply some of this thinking. And it becomes almost it's like developing an alternative muscle, and that's what you begin to develop and approach this way in a more helpful way. So the important thing is to first understand the situation and define the problem like we did, and then just define, okay, what could I do differently? How might I think differently? What might I do differently? What do I need to support myself in that moment? Again, like you diagnose problems medically, it's important that you diagnose problematic thinking or problematic behaviors and develop alternatives, and then just take it for a test drive. So try out a more self-supportive way of thinking in that problem, in a similar problem, or try out a different behavior and see how that works out. And because of that, then we're more likely to practice this the next time and the next time, and therefore choose a better alternative. So this process we can do at any point. You can, it's obviously it's a bit more challenging in the heat of the moment, but the more we practice this, the more you're able to integrate it into those situations. So again, coming back to your triggering situation, exploring, well, what could I do differently? So in as well as supporting and challenging your thinking, what could I do that's going to help me in that situation? What could I do in that moment that would be more helpful? Sometimes we just react and we say things immediately, maybe even just counting to 5, slow 5 breaths. I could then make a choice that's actually calmed the nervous system. So I'm more likely to respond rather than react. It's a little bit like going through, if you're all fired up, if it's a red light, you don't drive through a red light. So if your nervous system is completely agitated, it's not a good idea to then go, right, I'm going to respond from this place. Just even pressing the pause for 2 breaths, it allows it to go into amber. So, and then the green light means, yeah, it's okay to express here what I need in this situation. By the way, it's not always possible to do this, but this is about practicing so that it becomes more common for you to look at the moment and maybe ask yourself what might be more helpful here. What do I need to do? What's the best thing for me to do? Or what would be best here in relation to a colleague in this situation? or in relation to this patient, you know, pressing the pause, taking a breath and going, okay, what next? Rather than straight in from our emotions, straight being driven by our emotions. So if my feared situation happens, how will I cope? What resources do I have? That's also helpful to consider. And what have I done in the past that was helpful in this situation? Or how might somebody that I really admire, or somebody really that I look at how they work and I think, gosh, you know, I really admire their approach. How might they deal with this situation? So even taking that into consideration can help. And do I need to work on acceptance or letting go of control? So sometimes when we feel a bit anxious, we can try and control everything. And then we can micromanage ourselves, other people, and that can be very stifling in terms of, other people can feel really with those, we can get very demanding, shoulds, musts, have tos, and that can cause distress for other people. So do I need to work on acceptance, on the overall, on identifying what's good enough, and overall, how am I doing, rather than trying to be perfect in every way under all circumstances, which of course is not possible. Kind of live and let live a little bit more, going with the flow a little bit more, and not that it's not about letting go of our responsibilities, it's more about not trying to micromanage each moment. And of course, that's more supported if we're able to integrate self-care into our daily lives. And of course, with busy lives, it can be moments of self-care. So what does that mean? Well, it can mean, for example, physically just taking a walk, so stretching or getting away from the computer for a moment and, you know, just taking 3 deep breaths, grounding yourself, or just physically moving so you're not carrying tension from one job to the next. If you have a break, trying to make healthy choices around food that's going to energize you, nurture you, supporting yourself. And, you know, resting is really important. Sometimes when we get very, very busy, we can think, okay, even in our, that it's not okay to rest. And of course, you'd never say that to a patient. So it's about how do you rest and recoup for yourself? How do you take those moments to rest and recoup, which our body, our nervous system, our mind also needs. And so that's about emotionally managing stress, supporting ourselves so that we develop that reflective part, that emotional maturity, and that's sometimes allowing space and time for yourself to even write, or taking time out for yourself to show yourself some compassion. It could be a walk in nature. So looking after yourself as well as other people. Very often when you work in those professions that are about giving, it can be that the help for the helper is missing. So it is important to consider what kind of things you can do to support and resource yourself. And for some people that's spiritual. It can be time out for meditation or yoga or Tai Chi or any of those body movements that also include breath work, which again supports our sympathetic nervous system to kickstart the parasympathetic nervous system, and that sense of connectedness when we feel grounded, when we feel emotionally safe, that's where we connect with others. If we're constantly stimulated into fight, flight, freeze, then we're much more emotionally reactive. So finding that space for yourself, that self-care practices. So maybe writing down what helps you to feel emotionally grounded, to feel balanced. And can you increase those, or at least have moments each day when you take that into consideration. When we look at the mental health continuum model, we can have where we feel really emotionally connected and psychologically well. And in that space, there's normal fluctuations of mood, not extreme fluctuations of mood. Generally normal, healthy sleeping patterns, which of course, as we know, is really supportive again of psychological health, physical health. I mean, sleep deprivation is a form of torture. And as you know, when somebody like a patient has had lack of sleep for enough time, it's really agitating. It affects our physical ability to recoup and also our psychological, neurological pathways. So sleep is very important. And if you have issues around sleep, then just actually putting in some healthy sleep routine, hygiene, sleep hygiene approaches, very, very helpful If you might listen to, say, a mindfulness app like, for example, Beaumont Hospital have a very good pages on mindfulness. So if you just put in Beaumont Hospital mindfulness, lots of guided meditation, lots of explanations as to what those mindfulness approaches are for and why to do them. There's other apps like the CALM app, CALM app, that can help in relation to getting to sleep, and they've got also guided meditations to help you to support sleep if you wake up, or indeed the Headspace app. So lots of apps out there to help you to support sleep. And by the way, of course, you literally press play and turn your phone over. You're not looking at the phone with the blue light while you're listening to any guided meditation. Looking at, in terms of healthy approaches, you're more likely to express your needs. You've got, you're feeling positive in relation to your contribution to the work that you do, consistently, overall really well in that performance, and you're socially connected because you feel well and happy and joyful and exploratory in your approach to life. So you're much more likely to want to reach out to other people as well. So you're able to focus on the task at hand. You're able to break down problems into achievable chunks and get through it without all those worrying thoughts. And you're able to identify and tap into nurturing systems in terms of a healthy lifestyle. Now, if you're moving down that continuum, you might be more reactive. So you might feel more nervous, irritable, sad, perhaps even maybe difficulty falling asleep or staying asleep, and that affecting your energy, perhaps not trusting yourself and procrastinating, and therefore moving away from people, or not trusting people, maybe a critical mind, judgmental mind, not trusting situations or your relationships with people. If that happens, it's important that you begin to recognize your limits and begin to put things in place that are going to support more rest, looking at nurture, looking at exercise, how to support yourself, and engaging with more coping strategies. Identifying maybe people, places, or things that tend to be those things that magnify your internal stresses. And we can't always, you can't always choose who's going to be around you. But on the other hand, you can choose how you're going to engage with people who are more problematic in terms of behavior. So how much time do you need to be around them, or do you need to be around them? And just identifying those kind of stress triggers, and also, how to manage them. So maybe you may need to say, okay, less time with this person or no time with this person. So just identifying those relationships that are less than supportive, less than helpful. On the other hand, you might identify people that actually, you know what, I've lost contact with this person, but I really enjoy my time with them. I feel great afterwards. We have a really good time together. Those kind of increasing those resources as well in terms of sleep, in terms of nurture, care, exercise, all those things that are going to support you. And as we move down the continuum, you might feel that, well, actually, you're more anxious, catastrophizing, overwhelmed, underestimating your ability to cope, seeing everything as a potential problem. And that naturally is going to affect how you sleep, and therefore disturbed sleep, which increases that fatigue, decreases the performance, and you might move away from connecting with others. It's important, if you're in this space, that you identify, you're now gone into, heightened distress, and it's really worthwhile maybe linking in with your employee assistance programs or your GP, counseling support, perhaps psychological, emotional support through psychotherapy, or through CBT, or through maybe even you need a psychiatrist, or what kind of help do you need at that point. It is important, just as you would physically reach out for help, that you, if you find yourself moving down that continuum, that you identify that you need a little bit of support and do a bit of research around that. Social support, because if you socially isolated, which of course through that physical distancing, and that we've all had to engage with, very important, but it's also really important that we connect in socially. Without social connection, essentially, if we deprive ourselves enough of that, then actually it's the ingredient for depression. So if you've got you're feeling excessively low mood, underestimating your ability to cope, overestimating the chance of something bad happening, or feeling constantly negative and having a negative viewpoint of other people or situations or your own ability, it's really important that you reach out and get some professional help as well at that point, because you might find yourself really exhausted, really low and isolating from others. So important to link in with your healthcare providers and reach out for that support and begin to engage in lifestyle support that's going to help you to regain that physical and mental health. What happens when we look at, our nervous system and how it can get activated? If we've got ongoing stress, then we can activate that triggers internally in an automatic way. It triggers our internal alarm system. So just the same way as our house has an alarm system or our car has an alarm system, we have our own, as you know, our central nervous system. But our stress response system is very effective. It's helped us survive. In fact, it's even helped us survive in the last 2 years, where we physically distance, where we take precautions to keep safe as best as we can. But often then what happens is if we have repeated stress, internally, we can then speak to ourselves in a way which we can exaggerate the level of stress. So we can say overestimate or catastrophize, or look to the future with hypothetical worries and engage in constant hypothetical worrying or constant negative internal dialogue. And that activates our nervous system. That activates our sympathetic nervous system, which affects how we respond and how we communicate with others. So when we're releasing stress hormones, obviously our muscles are tense, it's increasing our heart rate, our blood pressure, where our body is getting ready to survive. So to either fight or be defensive, or to actually shut down, emotionally shut down, to protect, to literally numb out. So that can be internally cued as well as an actual external danger. We can internally cue that in relation to how we talk to ourselves. We can start that process. So repeated internal stress, if we perceive things as lots of stressful situations, we're going to actually overactivate our sympathetic nervous system. And that releases stress hormones constantly. And of course, that affects our endocrine system, our hormones, it affects our psychological system, it affects our digestive system. So that constant loop also affects us physically and affects our ability to connect with others, because when we're releasing cortisol, when we're releasing adrenaline into our system, it actually it minimizes our ability to release oxytocin, the bonding hormone, the hormone that allows us to feel connected to others and open to new experiences. So it is important that we develop our ability to elicit the parasympathetic nervous system, the more rest and relaxation, the aspect of ourself that can allow for emotional reasoning, for example, that allows us to press the stop button and to maybe perceive this to respond, and also to be able to pause, take some breaths, literally. When we take slow, deep breaths internally through our nose to the count of 4 and pause, and then release out to the count of 4, and then increase that to the count of 6 and out, pause, and out to the count of 6, we actually tell our nervous system that it's okay, we're not under threat. So it counteracts that escalation thinking. So and science is catching up with maybe what have been approaches in, Eastern approaches of yoga, of Tai Chi, where they include breath work in body movement. Actually, science is now showing that has a neurological impact, that it actually has an impact in our nervous system, because it tones the vagus nerve. It allows us to feel emotionally safe and secure, just literally allowing for slow breath work. So it's interesting. So if you take moments to pause and breathe slowly, that can help. If you take time out in nature, you're likely to do that anyway. Things like cold water swimming. There's You know, we can see a lot of people getting into that these days. And actually, again, that tones the vagus nerve, so it elicits the parasympathetic nervous system. So all of these things we can do to counteract stress in our daily lives, that's obviously going to offset. So beginning to be able to stop and step back and observe and notice the situation that's happening, notice the thoughts, the feelings, how you're carrying it in your body, and then notice, maybe is there something I can do here differently? Literally pause. Ask yourself, is there something below this arousal that I need to be able to assert? Is there some need here? Do I need to ask for help? Do I need to just explain to this person that when they're doing this, I feel this and I'm requesting a different approach? You know, that's conflict resolution. So noting, or indeed, is this situation reminding me of something else? So am I reacting from a past situation rather than this actual situation? And when we begin to observe those ways of being, we can begin to choose a different approach. Not always, because we're not saints, but more often. And then notice, you know, sometimes we find internally that we're agitated, or indeed that other people are meeting us with a form of aggression. So how do you notice when that's kind of active or when it's unhealthy versus healthy anger? Healthy anger being there's something not right here and I need to identify that, and maybe I need to identify my needs in that, or I need to express what's not acceptable about this situation to create change. If we didn't have that internal anger, we couldn't actually create that change, you know. So if we look at the, you know, Greta Thunberg, that, you know, that if she didn't feel angry about what was happening, then she couldn't have created all of that amazing positive change in terms of environmental awareness that is now, you know, happening. So it's not, all anger is not unhealthy. That's important. Sometimes it's an injustice, but it's how we express it can be unhealthy. So, you know, for example, it's not acceptable if we're physically expressing anger, or that it's not acceptable that somebody thinks that they can do that to another person, of course. Or that can be verbal. You know, we can, you know, a person can begin to name call, and that's unacceptable, active, unhealthy aggression, which is, you know, we can boundary that, that's unacceptable. But we can also experience passive aggression, where a person can ignore you or not respond to your question, not say hello. You know, that passive aggression, or indeed passive aggression can be where we begin to recruit allies against somebody. So we have an issue with somebody and then we try to draw other people into that feeling of anger towards that person. So that again is that passive aggressive approach. So being able to identify when that's happening, which and then maybe also expressing our needs around that, taking a step back, noting that, am I engaging in passive aggression? Do I need to assert myself here rather than engaging in passive aggression? Is there something here that needs to be said? Or indeed removing yourself from a situation where there's downright aggression, which is absolutely not acceptable. So how do we build on acceptance of maybe what's out of our control and what we'd like to see, you know, in a different way? We'd like to support ourselves, but well, we can learn how to manage our thoughts, how to increase resilience. And that's basically part of what we covered earlier. So when we have less of an internal or relational struggle, we're not likely to begin to make demands of other people. You should be doing this. I must be doing that. You should be, you know, that internal, we accept that there's a learning curve for people. We accept that we might have different opinions and they have different opinions, and that they might do things differently to us, but it doesn't make it wrong. It just makes it different, unless of course we need to point out things to people, and that's, but can we do that in a more assertive or guiding way rather than aggressive way, or passive aggressive or controlling way? So when we begin to show compassion towards ourselves and towards other people, like patients, like colleagues, essentially it works on a cognitive level. So where it's in our thinking. So I understand you. It's also in how we behave towards others. I compassionately feel for you, or I'm empathic towards you, and so I can show that in how I relate. And also motivational, so you want to support other people, you want to help other people. And you can imagine if you've got an internal dialogue which is more critical or judgmental, then you're less likely to feel empathic, and you're less likely to want to support. So being aware of our thinking and how we are with people is very important. And so that brings us on then to how we can hear and listen to understand, rather than maybe listening to what to do next. You know, obviously in busy environments, it can be really challenging. But how do we listen to hear rather than listen to fix? Now, sometimes, of course, in the role that you do, you've got to listen to know what to do next in a very quick way. But this is more about when you've got a little bit more time. Can you really meet this person? Can you hear them? Rather than operating from your own assumptions, your own internal dialogue. So asking those open questions like who, what, where, when, and how, Socratic open questions. Getting off the time. So just for the moment, can I be present to this person who's right in front of me? And getting off that time pressure treadmill. Can you allow yourself to just feel your feet on the ground and feel grounded in that moment? And say, okay, I'm busy, but there's a person right in front of me. The most important person right now is that person in front of me. So how can I hear them and listen effectively? Sometimes we're planning our next thing, the next thing we need to do, or the next place we need to be. And so we're not even seeing the person in front of us. We're not present. How can I be present to this person? Part of it is looking directly and nodding and letting them know that you're there. Of course, not staring, but just connecting and making eye contact. But also not trying to formulate your answer before they've finished talking. So you're not kind of busy thinking of how you're going to respond, that you just hear. What do they want to say? Because actually, sometimes just listening is enough. Or maybe sometimes you need to reflect back. So just let them know what you've heard. So can you paraphrase? Am I understanding you correctly? When you say this, do you mean this? Or, just clarifying questions. When you say that, can I just ask what you mean by that? So just allowing that person to feel understood. Or if somebody's saying, I'm really struggling here, I'm in a lot of pain, I can hear that you're really finding it challenging. So it doesn't mean you parrot back the same words, but you let them know that you've heard them by paraphrasing some of the same expressions back to that person. And then in the way that earlier, when we develop that reflective sense of self, we become a reflective nurse, a reflective midwife, and therefore we can choose, okay, what this person's needs are maybe here in this, in the here and now. And sometimes we need mentorship. So sometimes we need to connect in with somebody else that you maybe admire that can manage these stressful situations. How do they manage? Because these small things, these moments of connection, they do matter. And if you think about a time maybe when you've struggled or when you felt vulnerable, think about what helped in terms of how people listened to you and what didn't help. And in general, it's probably the same for other people also. Because, sometimes just being present to that person and hearing what they need to say is enough. But very often we can think, what do I need to do to fix? Sometimes we need to listen. And actually the answers come anyway. But allowing them maybe a little bit of time and a little bit of time to be heard is very, very valuable. And then, of course, naturally you're very experienced in what you need to do next in medically, but can we listen to understand this person? And again, thinking of maybe a colleague even, can I really hear this colleague? Can I really listen to this colleague? Because if you think about a time when you've struggled, what has been helpful in terms of how people have responded to you, and equally what hasn't been. And then when we're coming towards the end, but there's also things that we need to do to help us manage those busy environments, busy day-to-day lives. It's not always easy to put in these self-caring practices, but when we do cognitive restructuring, we're more likely to look at things from a problem-solving perspective rather than a problem-magnifying perspective. We're also, when we're actively listening or showing self-compassion also towards ourselves, we're much more likely to show it towards other people. It doesn't mean that we take an hour out a day to meditate. You might not have that time. However, you might take 5 minutes or 10 minutes. And it's amazing if you start your day from that perspective, how that can begin to, shape how you are with other people and yourself. So pressing time to pause, allowing for maybe when you finish your shift, before you go into maybe other responsibility, perhaps some of your parents, perhaps some of you are living with other people that you have to support, maybe allowing for a pause and what can I do right now to allow space to look after myself? That self-compassion. And indeed, healthy habits. Can you, for example, plan your meals for the week so that you don't get caught where you're really hungry and then eating things that aren't really nurturing and self-caring? Could you allow yourself to go to bed earlier so that you get much deeper sleep and much healthier sleep patterns? So some small changes can create big differences. And then just thinking to yourself, what goals do I have in terms of your overall health? It's not possible, by the way, I'm sure. Well, maybe it is, but it's not always possible to be healthy in every area of your life all of the time under all circumstances. So it's also about being compassionate. But are there goals that you'd like, where you'd like to increase in more healthy habits in particular areas? And, once we know what those goals are, then what are you willing to let go of and what would you like to increase? And that can help you in how to maybe formulate the thinking and behaviors that are going to support that versus that. And actually, meditation is very helpful in that regard. I mentioned about there's lots of resources out there in terms of mindfulness, but not just mindfulness. You might have your own practice or yoga or any of these things that are beginning to open up again, walks in nature, cold water swimming, Tai Chi, any of these approaches that combine breath work actually with body movement are really beneficial. Also journaling, gratitude journal, sound, repetitive sound. It's interesting. They've also shown that repetitive sound, and there's in fact Stanford research just out recently about the power of sound in terms of calming the nervous system. Really interesting, and supporting physical health. So hopefully the choirs come back very soon, and music, singing, repetitive sound, repeated sound supports relaxation. Breath work supports. What do we mean by that? We mean not that rapid breathing that's associated with sympathetic panic breathing, but more regulated, slow in and out breath. So breath work. So just anything that allows the body to feel, that, okay, we're not in danger here. Also allows the parasympathetic nervous system to kick in, rest and digest, allows us to feel emotionally safe and connected with others. So that's called the polyvagal theory. There's an actual theory that's looking at all of that now and doing a lot of research around the benefits of, body movement and mind-body approaches to our health. Makes sense, top down and bottom up. So if you can think about those things that you could do to support yourself in that way, and that increases awareness, and it also increases present moment awareness. So what does that mean? Well, you can do things like a body scan. The body scan allows you to take time out, and there's lots of body scans. If you even Google mindfulness body scan, you're going to come up with a huge amount of them. But there's also, as I said, the Calm app, Insight Timer app, INSIGHT Timer app. There's lots of apps out there that are going to support you in terms of guided visualizations, or just look up body scan, mindfulness body scan, and it'll take you through the process. And that is a process where you learn to just be able to scan through your body in a way combined with breath work to slow things down and to just become aware of where you're carrying feelings in your body, training yourself to be more somatic awareness, so that you can also identify when you carry tension, what you might need before it escalates into maybe, you know, regular muscle tension, or, you know, problems with your back or problems with your shoulders, etc. So you begin to observe your thoughts rather than get carried away with the story of your thoughts, your feelings, and your physical sensations as they arise. When you do mindfulness meditation, you begin to be curious about or interested in the type of thoughts that you're engaged with, but not necessarily labeling them as good or bad. I would, you know, include a little caveat here. If you're feeling anxious, it's not a good idea to, you know, meditate on those anxious thoughts. So you might just start with like much more short breath work, guided meditation for maybe 2 or 3 minutes, rather than doing 20-minute long body scan, for example, if you're feeling quite agitated, and that can help. A guided visualization particularly can help, rather than mindfully observing your thoughts if you're a very anxious person to begin with. You practice that ability to be able to witness your own thoughts, witness your own feelings, rather than getting carried away with the hooked into all the thinking and thoughts as facts. So you notice when you're feeling stressed. So I am noticing that I have fearful thoughts, or I'm noticing that I'm having judgmental thoughts, or I'm noticing that I'm having assumption thoughts, rather than going into the story and yes, she means it, and then this and then. And how you can begin literally by, you know, we can even do it right now. I'll do it with you, where you can just sit back into your chair and allow yourself to get comfortable and just notice, sitting back into the chair, what does it feel like? Do you notice any sensations in your body? And just allowing your hands to rest inside each other, just resting on your lap, or you might just allow them to be flat on your thighs, just feeling that connection, whichever feels comfortable. And begin by taking a deep breath in through your nose to the count of 4. Allowing that belly to rise, and then releasing fully through the mouth to the count of 4, as though you're blowing bubbles. So taking 3 full body breaths like this. And when you do this, just notice any sounds that are inside the room, or inside your body even, or outside the room. And notice how those sounds come closer and then fade away, and closer and fade away. While you continue to breathe this way. And now notice any sensations that you're carrying in your body. Just allowing them to be as they are, not bringing any kind of judgment towards them or curiosity or thinking about them, just noticing any sensations. And perhaps you're noticing that there's also feelings alongside those sensations. If there's any strong feelings present, just be aware of those feelings. We note them, we don't analyze them, and we just come back to the breath. And of course, very often our mind can pull us into stories of the mind. Our busy mind can get caught in our thoughts. And if your mind has wandered, just noticing that your mind has wandered. And don't go into the story, just notice busy mind and take your attention back to your breath. Deep in-breath and deep exhalation. And now we take 3 full body breaths as though you are breathing in from the top of your head all the way, taking that breath all the way down to your feet. So 3 deep breaths in, full body breaths, and releasing fully on the out breath. And then gently moving your fingers and your toes and opening your eyes, coming back into where you are as part of this webinar. And you might just focus on something in the room that you're in, a color, something that you notice, a shape. Just notice the colors and the shape of whatever it is you're looking at right now. Take it in. And maybe just note how you were before you did this little guided mindfulness pause meditation and how you feel now. And there's no goal, but just observe that process. And sometimes just taking time out to allow a few moments, a few minutes, a few breaths can allow you to do this and kind of reorientate yourself, gather yourself back into the center so that you can then begin your day from that place or continue your day from that place rather than being on that automatic pilot loop. And that's what present moment awareness allows for. So there's, as I said, there's lots of material out there. We're also going to cover it in other webinars that we will be covering in the Let's Talk About It series. So to kind of finish up with, John Kabat-Zinn was the pioneer of bringing mindfulness into more secular approaches and into the healthcare system, into hospital settings, etc. But a very famous quote from him, which basically encapsulate that sense of managing the day-to-day and managing our daily life stressors and relationships. You know, we can't stop the waves, but we can learn to surf. So we can't necessarily stop what's happening externally, but we can learn how to manage that on an internal basis, and that will affect our own sense of fulfillment and our own sense of how we can manage things. So thank you for tuning into this webinar as part of the Let's Talk About It series, a mental health collective for INMO members and also in association with Cornmarket and Zebo Health. And hopefully you can also join us in other webinars that we will continue with in the series. Thank you.